This medication called Bidil contains two drugs, hydralazine and isosorbide dinitrate, and it is used with other medications to treat heart failure. Both drugs are known as vasodilators, which means they work by relaxing and widening blood vessels so blood can flow more easily to the heart. In taking Bidil, follow your doctor's instructions on dosage and frequency. It's important to take it regularly to get the most benefit from it. Do not stop taking Bidil without consulting your doctor, as some conditions may worsen if the drug is suddenly stopped. Your doctor may need to gradually decrease your dose, so be sure to tell them if your condition worsens. If you experience headache, dizziness, lightheadedness, nausea, or flushing while taking Bidil, it's important to let your doctor or pharmacist know. Your body may need time to adjust to the medication, and these side effects may improve over time. Your doctor may suggest using an over-the-counter pain reliever like acetaminophen to help with headaches. If the headaches persist or become severe, be sure to notify your doctor. To reduce the risk of dizziness and lightheadedness, it's best to rise slowly from a sitting or lying position. While taking Bidil, it's important to remember that your doctor has prescribed it because they believe the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience numbness or tingling, severe fatigue, joint pain, rash on nose and cheeks, swollen glands, changes in urine, signs of infection, easy bruising or bleeding, fainting, irregular heartbeat, chest, jaw, or left arm pain, or signs of a serious allergic reaction. These are not the only possible side effects of Bidil, so be sure to reach out to your doctor or pharmacist if you notice any other unusual symptoms. Before taking Bidil, make sure to inform your doctor or pharmacist if you have any allergies to isosorbide dinitrate, hydralazine, or similar drugs. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's important to discuss your medical history with your doctor or pharmacist, especially if you have heart problems, low blood pressure, or have had a recent head injury. Bidil may cause dizziness, and using alcohol or marijuana can make it worse. It's important to avoid driving or using machinery until you can do it safely. Also, be sure to inform your doctor about all the products you use before having surgery. If you are pregnant or breastfeeding, discuss the risks and benefits of using Bidil with your doctor. Drug interactions can affect how your medications work or increase your risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Bidil include certain drugs to treat migraine headaches, drugs for erectile dysfunction or pulmonary hypertension, MAO inhibitors, riociguat, and vericiguat. It's also important to be cautious with products that could worsen heart failure, such as cough and cold products, diet aids, or NSAIDs. Additionally, avoid using medications containing isosorbide mononitrate while using Bidil, as it is very similar to isosorbide dinitrate. Lastly, be aware that Bidil may interfere with certain lab tests, so make sure to inform the lab personnel and your doctors. If someone takes too much Bidil and has serious symptoms like passing out or trouble breathing, they should call 911. Otherwise, they should call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include slow heartbeat, vision changes, severe nausea/vomiting, sweating, cold/clammy skin, bluish fingers/toes/lips, chest/jaw/left arm pain. This medication should not be shared with others. It's important to have regular lab and medical tests while taking Bidil, including a complete blood count and blood pressure monitoring. Make sure to keep all your medical and lab appointments and consult with your doctor for more details. In addition to taking Bidil, making lifestyle changes such as exercising and dietary changes may help the drug work better. Talk to your doctor or pharmacist about any lifestyle changes that might benefit you. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just wait and take that one as usual. Don't take extra to make up for the missed dose. Keep Bidil at room temperature and away from light and moisture. Don't store it in the bathroom and make sure to keep it out of reach of children and pets. When it's expired or you no longer need it, dispose of it properly by consulting your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.